Hello, my name is Sylvia Brown, and I am the community educator here at the Pittsburgh Poison Center. Today, I am going to be talking with Dr. Edward Krenzelok, who is a former director of the Pittsburgh Poison Center and the Drug Information Center at the University of Pittsburgh Medical Center, a professor of pharmacy and pediatrics at the University of Pittsburgh, and the Dr. Gordon J. Vanscoy Endowed Chair in Pharmacy. Dr. Krenzelok served as the director of the Pittsburgh Poison Center for 30 years. How are you today, Dr. Krenzelok?
I'm very well, thank you, and it's great to celebrate 50 years of the Pittsburgh Poison Center and Mr. Yuck.
Yes, I thank you and appreciate you joining us today to talk about how poison centers have developed over time and your role and contribution to poison centers nationwide. So let's start with.
Thanks for the opportunity. It's going to be a fun opportunity for me.
Awesome, good. So what was the early structure of the Poison Center network?
Well, if you have to go back to about 1953 when poison centers first started, and the first poison center was in Chicago, but it was a very rudimentary group of hospitals. Wherever someone had a phone, they could call it a poison center. And when the Pittsburgh Poison Center started in 1971, there were over 700 poison centers in the US. And Dick Moriarty was a fellow, a pediatric, I think he was a chief resident at Children's Hospital at that point in time. And there were calls coming into the emergency department at Children's for poisonings, and maybe a grand total of, they were overwhelmed, 3,000 calls a year. And now they're 50, 60, 70,000 calls a year. But there were 3,000 calls a year coming from the local poison or local area. And there were actually 7 poison centers in Pittsburgh at that point in time. So Children's received a grant, and I think it was from the Pittsburgh Foundation. I'm not entirely certain, but I think it was the Pittsburgh Foundation for about $1 million to fund a poison center and to figure out how to prevent poisonings from occurring. Hence, Children's contracted with an ad agency called the Maitland Agency in Pittsburgh, and a gentleman by the name of Dick Garber, who was vice president of the agency. And Dick worked with everybody at Children's to kind of learn about poisoning and so on, put together focus groups, and they were trying to figure out what to do to create awareness of poisons and poison centers. And that was the time when the smiley face evolved. And so, I'm really dating myself, but it was the old smiley face had just evolved. And so they kind of developed a variety of different Mr. Yuck faces. And it wasn't called Mr. Yuck. And they did these focus groups with children and adults and so on, and looked at colors. They looked at colors. They actually did some science behind it and found out which colors might be attractive versus repulsive to a child. And the sort of fluorescent green color that we know as Mr. Yuck is the one that prevailed as being repulsive to children. And then some kids said, oh, he's yucky. And hence the development of the name Mr. Yuck. Well, other poison centers across the country, remember I said there were about 700, were getting wind of this, and they wanted Mr. Yuck stickers. And I remember I was doing a pharmacy internship in 1971 at the University of Wisconsin Hospitals, and there was a poison phone there. And I was always dreading I'd be the intern that would be there and I'd have to answer a poison call. And all I remember was I never had to do it, number one. Number two, there were Mr. Yuck stickers around. Well, then I went on to the Pharmd Program at the University of Minnesota, and was on the faculty at the University of Minnesota, and ultimately was working as a clinical pharmacist in the emergency department at Hennepin County Medical Center when there came the opportunity to become director of the Hennepin Poison Center in Minneapolis. Let's back up a little bit. So when the whole poison center thing was evolving, Moriarty and Garber put their heads together and they developed what was called the NPCN, or the National Poison Center Network. And they actually developed a template, and I have a copy of it. It's a book called the Source Book, the NPCN Source Book, and it talked about how to set up a poison center. And what they did was they developed, and this sounds bad, a pyramid scheme, but it really wasn't a pyramid scheme, but think of it as being a pyramid. And Pittsburgh sort of was the self-proclaimed national poison center, and they were at the top of the pyramid. The next level down were regional poison centers. And below the regional centers were satellite centers that probably weren't open 24 hours a day. A regional center had to be open 24 hours a day, 7 days a week. Satellites could be open a few hours a day, and then their emergency department would call the regional poison center. And then there was a system of member hospitals that were developed as well. And then the member hospitals would call either the satellite or they'd call the regional center and receive the poison care. All of them were connected by some very rudimentary fax machines. And it was really, they were a challenge. Talk about technology today. They were a challenge in technology. It was a round cylinder that had a lip on it, and you would stick a sheet of silver fax paper on, and you were sending information, and this would start going around, and it would burn an image on the silver paper, and that's how you transmitted information. So the whole pyramid at the top was Pittsburgh. They developed a very elaborate card system. There was a full-time staff developing let's say for Clorox or for Tylenol or whatever, and they had very detailed information about how to treat an overdose and so on. And at that point in time, I think we had something like at the Hennepin Poison Center, 7 books and a couple of pieces of microfiche, and that was all we had. So we relied upon the people in Pittsburgh to provide us with information, and then and it was well ahead of its time. It was well ahead of its time. The other thing they did was they developed a very sophisticated data collection system, and we called it Login, Login, but login. And actually what would happen there were medical records that they would send us, and each one, you'd fill it in, but each one was associated with a code. And they developed a smart code that was 15 digits. Let's say the first 5 digits said that it was an analgesic. The next 5 digits said that it was Tylenol as a brand. And the third 5 digits would say 325 milligram tablets. So they began then to actually compile national data way before the American Association of Poison Control Centers did. And there was a federal agency called the National Clearinghouse for Poison Control Centers out of the FDA, and they would send poison centers punch cards, and you'd punch out, yes, there was an acetaminophen overdose or whatever, and you'd send the punch cards in, and there was really rudimentary data. So Pittsburgh developed this fabulous system of regionalization and data collection before anybody, and became really the model for the country. So a few years later, other poisons, the American Association of Poison Centers was founded, and there was actually a manual put together in 1978 by a group of people, including Dick Moriarty, on regionalizing the nation's poison centers. And there were still probably 500 or 600 at that point in time. But this was a way to consolidate it down and to refine it and to improve quality. So Pittsburgh was really at the forefront of developing what we have today in terms of a whole nationwide poison system. So now we're down to something like 53 poison centers in the country. And a lot of that was driven financially as well. And medical legally, poison centers hung out their shingle and weren't there always to answer a poison call. I remember when I started at the Hennepin Poison Center in Minneapolis, there were there were three of us, and we worked from 7 in the morning till 11 at night. 11 at night, we flipped the phones over to the emergency department. And at 3 in the morning, I'd get a call from the emergency department saying, oh, we have a call on this. What do we do about it? And then eventually we became a regional center within the NPCN. And that sort of led me into getting involved in that. They developed an advisory board at the NPCN, and we met a couple of times a year. And I was the chairman of professional education for the NPCN. And so all these centers from about 25 states would come into Pittsburgh, and we put on an annual symposium every year. I pulled out of my files a couple of covers, symposia covers. This was a 1978 one, and this was the 1980 symposium that we had. And we basically used all the people that were Poison Center directors to come in and be the experts and provide the education. So that was 1978. So this sort of evolved and it really got going. And in 1982, Dick Moriarty resigned as director of the Poison Center after having started it in 1971, and they did a nationwide search. And I'd been, very, very involved with the NPCN, and so they invited me to interview for the job. And eventually, I had the opportunity to become director of the Pittsburgh Poison Center in toward the end of 1983, and was the director until the end of 2012. Wow. So it was a long, wonderful career in Pittsburgh. When I was hired there, they gave me 3 goals. They wanted the Poison Center to be one of clinical excellence, academic excellence, and then the third one, which I really think the board of directors of Children's was number 1, but they had to tell me the other 2 first to entice me to come. They wanted the Poison Center to be self-funded. And I think that's what helped us do the things that were really important, providing great clinical service, number 1. And then we became a real center for academic excellence. I would say I had wonderful staffs that worked at the Poison Center. They presented papers at national meetings. Every one of them published papers in toxicology or medical journals. And I think over the 30 years that I was there, our group published with book chapters and major manuscripts and so on, probably about 500 publications. And everybody who worked there had an opportunity to do that and contribute to what we didn't know about poison information, but adding answers to unknown questions. And that was it. We'd come up with an unknown question and we try to solve it. And so the staff was absolutely fabulous. They all became certified specialists in poison information. And that was our real mission and focus, were those 3 areas, but mainly clinical, academic, and because we had to raise money as well. So that's sort of how it all evolved over the course of time. And we went from, tiny little offices to when we were in the Rangos building, or not the Rangos building, down on the south side, we had 4,000 square feet. So there was a lot of development and so on of the Pittsburgh Poison Center.
Amazing. So let's talk a little bit about your time at the Pittsburgh Poison Center. What were some of your roles and responsibilities in the Poison Center itself?
Well, I guess the best way to describe me was, and saying it humbly, but I was captain of the ship. I was responsible for, cooking for everything. And it basically was, there were no medical directors at that point in time. Clinical toxicology was a emerging specialty. And so for the first 10 years or so, I really didn't have any medical backup. I knew several physicians at UPMC and at Children's that if we had a medically related question, we would call them. but I was responsible for it clinically until we had the evolution of medical toxicologists that could begin to take some of the call and so on. As I said, as when we were chatting before this, the Institute of Education Communications was developed, and that was sort of an offshoot of the Poison Center, but under a separate budget center at Children's Hospital. And they, under the leadership of Dick Garber, developed lots of the poison education materials that we used in Pittsburgh and that were used across the country and throughout the world, for that matter. And that was a very important group because it took a lot of burden away from us from an education standpoint. And we didn't have an educator like you at that point in time. So my education was, yes, I went out and did lots of talks. I went to schools, I went to hospitals, I went everywhere and did tons and tons of media to promote the Poison Center and so on. Even it was beyond the days, but back in the beginning, people were enthralled by the Mr. Yuck jingle. And hopefully you found a copy of that. You know, Mr. Yuck is mean, Mr. Yuck is green, home is full of lots of things children should not touch, and so on. But that was a very catchy jingle that attracted people. And I remember waking, when I lived when I was director of the Poison Center in Minnesota, woke up in the middle of the night one time, my television was on, and I heard, "Mwah," and it was the Mr. Yuck jingle at 3 a.m, prime time. But it really was promoted, and Pittsburgh was looked at as being really one of the probably 2 premier poison centers in the country. I would say the other one was the Rocky Mountain Poison Center, and then the Pittsburgh Poison Center. I may be a bit biased in that, depending upon who you talk to, but we were a premier poison center as poison centers evolved across the country. So I had lots of responsibilities, from HR to budget to all the clinical issues to every aspect of the Poison Center. And there weren't training programs for people like me. I had to learn on the go. You know, a lot of times you were a chapter ahead of the students or of the person who was calling you, or can I get back to you in 10 minutes with an answer? It was that way because it was quite an evolution. It was fun being there in the sort of infantile stages of it, and then to see what poison centers, and especially the Pittsburgh Poison Center, has become over the 50 years.
Yes, absolutely. Well, since we are celebrating 50 years of Mr. Yuck, let's talk a little bit about Mr. Yuck. So how exactly did the Pittsburgh Poison Center utilize Mr. Yuck as an educational tool?
Well, we used it, again, materials. All our member hospitals every year would receive free 1,000 sheets of Yuck stickers and hundreds of brochures, and we sent out mass mailings to all of our member hospitals free of charge, and they were largely responsible for distributing materials in their emergency departments and pediatric clinics and so on. Then we would send out mailings to schools. We got very involved with Giant Eagle and Giant Eagle pharmacies, and they served as a major distribution site for materials. So we didn't do a lot of the hands-on things that you're doing, Sylvia, where you're out, teaching poison prevention. Yes, we did some, but we were limited. I couldn't afford to have my staff out in schools when indeed they needed to be answering the phones. And so a lot of that fell on me, but I only had so much time to do that as well. But in Pittsburgh, we used Yuck, and we let a lot of other people do our education for us directly. And then what I saw happen over time, Sylvia, was that Mr. Yuck we began to really promote it as a poison center awareness tool, as well as a poison prevention tool. Because yes, it was inconceivable that people were going to put a Mr. Yuck sticker on everything that was hazardous in their home. You needed to keep the poison out of the reach of the child, rather than the Mr. Yuck sticker on the bottle as the deterrent and leaving it under the sink. So we taught those strategies, but we really focused on then creating tremendous awareness of the Poison Center itself. You know, with the national 800 number, we had our own local numbers and so on, but then we went to the 800-222-1222 number and basically blanketed as much as we could of our service area in Western Pennsylvania with stickers and pamphlets and everything to create awareness of poison prevention and of the Poison Center itself.
Mm-hmm. So what did you see as a response from the community when you started utilizing Mr. Yuck in that fashion?
Well, our call volume skyrocketed.
Okay.
You could see with every, and that was the desired goal. Right. With every intervention or in every new strategy that we implemented, you could see increments in the call volume. And that was very rewarding because we knew that we were being effective. And then we would do, we highlighted some areas within the city where we did just a focused campaign. And then we monitored those telephone numbers. That was before there were a lot of cell phones. We monitored telephone numbers and zip codes because we always got a zip code, but the zip code was the most important. And that zip code would tell us how effective we were in getting into those areas. So we could say, okay, we just did this, let's say for McKeesport, we did this huge influx of education, and you could see your call volume go up every time you did something like that. So we used the data to help direct our efforts within Western Pennsylvania.
Okay, awesome. So after 50 years, how is Mr. Yuck still relevant today?
Well, it's just amazing. I live in northern Wisconsin now, and still a lot of my friends know me as Mr. Yuck. And when I go to national meetings, you know, hey, Mr. Yuck, how are you? So I think there's a certain amount of carryover. People are really aware of Mr. Yuck. I'm not sure if the awareness of Yuck itself is as prominent as, say, it used to be, because it used to be that it was just Mr. Yuck, and then the Rocky Mountain Poison Center had Officer Ugg, and those were the two poison symbols. But as the American Association of Poison Control Centers developed their educational materials, I think there has been perhaps a little bit less emphasis on Mr. Yuck nationally than, say, there used to be. But still, especially, I don't know about young children as much now, but I know people that are young adults and to elderly people still own a Mr. Yuck, and they can hum the jingle. They a lot of remember the name or the number. I remember I was at something and there was a paramedic that said to me, our old number was 412-681-6669. And she said, well, if you're sick and you ate one, you'll be sick, and then you'll be fine if you call the Poison Center. And that's how the paramedics were remembering the number before we had the 800 number. So it's just fun how Yuck evolved, and he's become, you know, an icon. In the poison, every poison center across the country is well aware of Mr. Yuck and the influence Mr. Yuck has had. But all these other programs again have developed, and I think it's diluted out Mr. Yuck a little bit, unfortunately. But I know at the History Center in Pittsburgh, there's a great display of Mr. Yuck memorabilia and the whole evolution of the program and the Poison Center. But I think the thing that people don't realize today's young people and people in poison centers, is how the Pittsburgh Poison Center started in '71 and evolved and developed the regionalization concept, the whole data concept, the whole poison information concept. And it was really the foundation upon which I think poison center operations today are founded. And again, my bias, but I really think that's the case.
All right, so last couple questions. We'll do some more fun personal ones.
Sure.
What is your fondest memory of your time at the Pittsburgh Poison Center?
Oh, I think my most fond memory would be some of the weird calls that we had. Uh, maybe not so much fond as bizarre. My fond memories would be uh, all the all the staff members that we had over the years, and uh, back when the whole COVID thing started, we had several uh, text calls. And I said, enough of this texting. Why don't we all Zoom? And so we had Zoom calls, and it was just fun to see so many people and talk. So uh, we had just the staff of the foundation of the Poison Center, and without the Poison Center staff, I don't care who's director, who's doing anything else. The staff is the foundation of the Poison Center, and the other ones that save lives and calm people down. And
So, what legacy do you hope to have left regarding the Pittsburgh Poison Center or poison centers across the country in general?
well, that's a great question. And I've never really thought about that, to be honest with you. I guess probably the most important thing is we operated a really good poison center, and it was a team effort, um, and we saved people a lot of grief. We helped a lot of people. I'd like to think that I had a role in that. I was very involved academically in toxicology and doing a lot of writing and research and being involved with national organizations and trying to improve patient care. So I everything that we did, that I did personally, was all aimed at trying to improve patient care. And so I guess if there's any legacy, I would hope that people would remember me as a person who tried to improve patient care.
Awesome. Well, thank you so much, Dr. Krenzelok. I appreciate you taking time to speak with me. It was so interesting to listen to the history of poison centers and the Pittsburgh Poison Center and Mr. Yuck. I thank you so much for your time.
And thanks for the opportunity, and happy birthday, Mr. Yuck and Pittsburgh Poison Center.
Absolutely.